Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons, on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Doctors Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz podcast will surely satisfy your podcast fix. All right, now let's dive into this episode.
Hey guys, it's Dr. Butz here with Fuller Butz podcast, behind the scenes look into plastic surgery, and with my co-host, Dr. Fuller. We're going to take a little dive deeper into more specific consult-related questions to ask. We've had a lot of great guests on recently, but want to break that up with more honed-in advice and recommendations for how to go about your plastic surgery journey. So Sam, we're going to start off with tummy tucks and how to approach that, what kind of research to look at. And, when patients come into you for a consultation, what are some of the, starting off, if they're looking at like, am I a good candidate? How do you go about, sifting through some of their different factors that may make them a better candidate or not as good of a candidate for a tummy tuck?
Yeah, so hopefully listeners after this episode understand if they're a good candidate or not for tummy tuck and are excited about it if they are. So this is a cheat sheet for some patients who are considering the consultation. As far as, a patient walking into my office, they should be asking, am I a good candidate? Things that I look for to determine if they're a good candidate include their past surgical history. So if they have significant medical issues, heart transplant, kidney transplant, immunosuppressions, they're at higher risk of having wound healing issues, infections. So you just want to make sure that they're of reasonable health. I've recently did a 74-year-old patient who required no post-op pain meds afterwards and did absolutely well. So I would say age is more of just a number, but you just want to get their overall health and well-being for starters. Also want to look into their past surgical history. So, what abdominal surgeries have they had before? Are there any remaining obstacles or problems within the abdomen, such as large hernias, needing more abdominal surgery? Those would be things to address beforehand prior to completing a tummy tuck or an abdominoplasty. As far as switching over from the medical reasoning behind, am I a good candidate? How would you address a patient's expectations or lifestyle in determining whether they're a good candidate or not, Dan?
Yeah, I think another big thing is, are you done having children or not planning on having more? So, most commonly we're seeing, mothers who've had multiple pregnancies, loose skin. They want to restore that kind of contour for the muscle separation, the loose skin, and for some extra fat with liposuction. So planning on not having pregnancy. I've had a few patients who have gotten pregnant kind of just accidentally, and actually the results look quite good, but it's not something you want to be planning on. And your goal should be really trying to, focusing on restoring the skin laxity, muscle separation, and improve those contours. So being at a stable goal weight is really important, and having a general healthy lifestyle. If you're smoking, not eating well, gaining weight, you're likely not a good candidate. So trying to optimize everything, and I often talk about kind of a happy weight. Not everyone can kind of get down to their, pre-baby weight, but getting as close in some place that they can maintain afterwards is really important. So I think that's kind of, some of the key things to consider, again, healthy lifestyle, healthy weight, and kind of, again, big picture, not planning on any major changes like pregnancy. And then the other thing, then we start talking, go ahead.
I usually tell patients, you want to be at your goal weight, happy weight, stable weight for about 3 or 4 months. You just don't want to see this roller coaster up and down. I personally recommend that new moms wait at least a year just to get some of the baby weight off, to get through that first year, which is tough with a new child. And then just to ask them about their support system. Do they have friends, relatives, family members who can help them with their young kids as well? I think those are all good points that you brought up as far as other key points on whether a patient is a good candidate or not.
Yeah, and there's a lot of different types of tummy tucks, right? So oftentimes it's kind of when you move past the kind of initial discussion of what their goals are, concerns, and oftentimes we're also talking about breast surgeries, maybe combining it into mommy makeovers. But then moving into the exam, what's going to be the right surgery for them? There's mini tummy tucks where we're really just pulling the lower abdominal skin tight, kind of not really addressing the upper abdominal skin laxity. That tends to be, good for just minor amounts of laxity. Sometimes, obviously lipocontouring with that. More commonly, we're doing full abdominoplasties where that scar is longer, hip to hip, and you're kind of getting rid of all the skin up to the belly button and tightening all the muscles. When do you start talking about kind of some of the extended or, 360 or kind of full torsoplasties for patients?
Yeah, it goes back to the first question as far as who's a good candidate and what their goals are. So sort of establish what their goals are for each patient at that first visit. If they're looking for circumferential enhancement, then 360 liposuction or liposuction on the back as well can really improve that. If they carry their weight metabolically in the lower back, the flanks, then that might be an area that you want to address. We've talked about add-ons such as hip dip, fat transfers, and things. All of those are adjunct procedures for tummy tucks. My big fork in the road that I'm deciding between whether it's a regular or a traditional tummy tuck versus an extended tummy tuck typically are patients who've lost a lot of weight. And that may be 50, 75, 100, 150, 200 pounds now with these sustainable weight loss medications where even doing a hip-to-hip incision is just not going to be enough. There's still going to be a lot of laxity wider. And the reason why we differentiate, or at least I differentiate that, is one is to give you a safe and reliable result to make sure that that's lasting, to not have to do revisions or additional procedures. And to me, there's a cost difference. So, it's all about the length of time it's going to take to do the surgery. So a mini tummy tuck, I would say, would cost less than a standard tummy tuck just because there's going to be less time involved, less work. And an extended tummy tuck typically is an additional price because it's a longer OR. There's more incision, there's more sutures, there's more instruments and equipment that's being utilized. There's a longer anesthetic, not significantly, but that's typically the big differences and why I'm deciding whether this incision needs to wrap around the corner of the waist or it can be stopped at the traditional spot. Dan, any add-ons for the how you would decide extended versus standard?
Yeah, I think, it really comes down to where that skin laxity ends. Sometimes that overhang or apron of skin, goes further back and you try to stop it short, it just bunches up. People, call that dog ear, and you really want smooth contour. So, oftentimes even when I mark, it would be close to a full, but we do a bunch of liposuction on the back and also there's more laxity there. And I'd rather chase that scar, a little bit longer, maybe not a full extended, but to make it smooth. So again, I think it's just all about looking at each individual's anatomy and making sure you're giving them the right choice and not doing the same thing for everybody necessarily. You mentioned safety, Sam. These can be pretty long surgeries, especially when you're combining them with different things. What do you talk to patients about? Risk with surgery, length of surgery, anesthesia. Some people come in kind of scared and nervous about their potentially first surgery that they're having. How do you kind of go about preparing things for them and making sure they have a safe experience?
Yeah, a couple different tips and pointers that I do. One is I always have a preoperative visit, so it's always an additional appointment to really decrease some of the fear, the anxiety, and increase some of the excitement and enthusiasm, and just get them mentally motivated and ready to go. So it's really about mental preparation. Make sure that their overall health is good. Make sure that they are not shocking their systems with any shock and awe, nutritional changes, exercise changes. Give them the prep that they need for post-op care, which we'll get into shortly. But really just advising them that it's normal to be nervous, that's natural. However, anesthesia is extremely safe. I did 2 tummy tucks this morning. Each of them were about 2.5 hours long. Patients were out the door, back home, resting comfortably at their house in an hour and a half later. And so it's something that's a well-oiled machine if done properly at appropriate aesthetic and outpatient surgery centers by board-certified plastic surgeons. Things that you want to be realistic with them is that you should expect some pain afterwards. This is a surgery. There's going to be scarring. Is always a risk of bleeding and infection when it comes to surgery and making incisions. We limit that by dosing antibiotics during the surgery. We have plenty of medical equipment to limit the bleeding that exists during the surgery, and those are fairly uncommon problems. You sort of talk about the worst case scenarios as far as blood clots, fat embolism, death, like all the scary things that can happen as, minimally of an invasive procedure as, dental extraction to, carpal tunnel surgery. There's always can be events that can happen. With the tummy tucks and mommy makeovers, you're really dialing into the safety from the get-go with having an anesthesia provider present and, limiting and diminishing those risks as best as we can. So in addition to bleeding, infection, some scarring that will exist, which we need to talk about. There's no such thing as scarless surgery. There was a recent social media trend on that. Dan, what other safety tips or fairly common problems or side effects or complications do you talk about patients that might need to be addressed in the post-op period?
Yeah, I think you nailed a lot of the big ones. Again, the big scary stuff we can optimize. So not smoking is going to reduce your risk of wound healing issues. If you are diabetic, make sure it's well controlled. Pre-op nutritional optimization can really help heal better. Blood clots, we want you up and walking at least minimum 4 times, 6 times a day. Again, historically, years ago, a lot of patients would spend the night at a hospital after tummy tucks, and they were stuck in a bed and not mobilizing, IVs in, and there was a higher risk of blood clots because you weren't able to mobilize. That risk, I think, has really dropped with going outpatient surgery to kind of force you to move around a little bit. But yeah, scars, you have to be important to know where those scars are going to be, and again, optimizing scar placement. So we want a low, easy to conceal scar. A nice looking belly button, I think is really important. Looking at the surgeon's before and after photos, trying to find consistently good belly buttons that you can identify with. Infections are very rare. The most common thing I tell people we run into, which is these are relatively long incisions, is maybe a little suture inflammation or a hair follicle kind of growing through the suture that requires a little topical ointment. Needing extra antibiotics, needing extra surgery is extremely rare, fortunately. I think that comes with, again, doing a lot of these. We do these in an outpatient surgery center where we're not seeing patients who have infections, or you're not in a hospital setting where people, potentially are sick around. So all those things can help. All those little things can really help decrease those relatively small risks to be even lower.
I think the more minor things, Dan and I have seen a lot of, and so we troubleshoot pretty simple problems such as a little rash or something from the prep, or some glue, or making sure that the compression garments are changed regularly. And speaking of which, the next key point to discuss during a tummy tuck consultation is what the recovery process is like. And so it's always great to see the before and afters. Want that bod back that maybe your kids have destroyed, or you've lost the weight and now you want to reward yourself, and all that's awesome. It's why we do it. We love going through these transformations, but it's important to invest in the recovery. So Dan, why don't you tell the listeners what you tell your patients at the tummy tuck appointment as far as the recovery process and the steps for the recovery?
Yeah. So, like you said, we also have a pre-op appointment as well. So I kind of review all this stuff. Actually, we have a pre-consultation video we send patients to kind of, get them a little introduction to what to expect. Then at the consult, we would discuss it. And the pre-op, we even go into further detail, really trying to over-prepare people. And that way, there's no surprises, and it's often a lot easier than they expect. But it's a big surgery. I never try to downplay it. You're often hunched over kind of at the waist for a good 7 to 10 days on average, and kind of then slowly standing upright as it feels okay. We never want to be stretching that out. First 2 to 3 days, you're probably resting mostly, but getting up and moving around a little bit. Wearing compression garments for 6 weeks, avoiding heavy lifting for 2 weeks, and then kind of between 2 and 6 being pretty cautious, and then back to exercise, kind of slowly introducing it between 6 and 8. So those are kind of the big things I kind of try to break up recovery into these different phases. And we're always available to answer questions that we maybe, it's hard to answer every question or prepare for every scenario, but we're available afterwards. So we really want to not just be there to deliver a great surgery, but also kind of hold their hand through that early phase, which can be stressful, to ensure they, get through that as quickly as possible. And yeah, pain meds, I think we've talked about this before, but, long-acting nerve blocks. I'm sure you can maybe talk about Exparel. What do you tell patients about pain control afterwards?
Yeah, I just want to say that you just dropped some insane knowledge right there, and it's almost like you've said that before. And so we all have our sort of robotic way of saying things, but you answered so many key questions that a lot of times, as I go through that same spiel that you just did, patients, their eyes light up, they're excited. They're like, wow, you just answered like 99% of my questions just by going through that process. And it's all about having a routine, sticking to the routine. And then, for me, the only other thing to add on would be as far as dressings, for us, we're doing mostly drainless tummy tucks. So there's no drains, no wound care, minimally. You just basically have glued on bandages that we take off. I have made the change after being berated by Dr. Butz on a podcast about Aquaphor, where I now switch to Aquaphor after about 3 weeks of steri strips, and just to strengthen and build up some skin has worked out very nicely. And then I start scar care anywhere between 4 to 6 weeks with silicone gel sheets. And then, silicone gel or vitamin E ointment for the belly button, because again, we're trying to make that scar look perfect, especially with the belly button, which is the most visible part of the tummy tuck. Pain is subjective. And so getting back to your question, as far as pain meds afterwards, I prescribe a pain medicine. It's at their pharmacy. They can take it if need be. I've had patients who strictly do Tylenol, ibuprofen. I've had patients who take a pain med to help them the first couple of days, but I've really never had to make a refill on that. Patients are doing well. You mentioned hunched over 7 to 10 days. I tell them the goal would be to walk up tall, standing at your first post-op appointment, which is about a week out. And I would say most patients can do that. The recovery is just exciting. Patients are happy, and I think that helps with their pain. I do use Exparel, which is a long-acting medication that I personally inject into the abdominal wall right before we do the rectus plication or muscle repair. That can last anywhere from 2 to 3 days metabolically. So that really helps to take the edge off afterwards. Has been a huge game changer, allowing patients to walk out of the facility, as we said, an hour or two later with very little pain, even though we've sometimes have repaired very wide rectus diastasis like I did today in a patient who had multiple kids, just very stretched out. And, their core strength, their lower back pain, their GI/GU issues are going to go away. So lots of great things happening with tummy tucks. Dan, can we talk about results as far as tummy tucks? Patients usually want to know what it's going to look like and when is it going to look like that. And so how do you control temper expectations? When do you tell them that you're looking at the finished product?
Yeah. I think that's, it's a really important part of that consultation process, to kind of prepare and kind of try to give them an idea of what they may look like. And that's where, we have 3D simulation, tools for breast augmentation. I don't think they work as well for body surgeries. So I really rely on before and afters of other patients. And I kind of click through a lot of different body types and different degrees of muscle separation, degrees of weight loss. And normally at some point, the patient will be, oh, that looks just like my abdomen. So they can kind of get a sense of where, that person might be and what they might be able to achieve. And again, I tell everyone our main goals are getting rid of all that loose skin, priority, keeping that scar nice and low, a really natural looking belly button, and contouring with liposuction. So it's not just pure flat, but kind of, again, some shadows and shape where normal muscle kind of contour should be. So it's kind of really more in that more modern abdominoplasty, creating a natural looking result. And Sam, you kind of hinted at, diastasis repair. I think that's an often overlooked kind of benefit. And not only does it flatten, but those functional benefits. You kind of breeze through some of those. I want to kind of go into that a little bit, what patients can often expect of functionally feeling better.
Yeah. Do you still use your term low definition lipo when you're talking about your tummy tucks and mommy makeovers?
Yeah.
I remember that from season 1.
Yeah, I like that term, low definition. I don't like this, etched in six packs. That doesn't look normal.
Yeah, and I
But
think that's also just part of
highlights,
setting expectations. Yeah, it's
Yeah,
expectations. I tell them like, hey, you're not going to have a six pack, and a lot of patients are like, oh no, I don't want that. Like that's not what I'm
right.
going for. But I think just saying it out loud, everyone's on the same page with that. Uh, a rectus diastasis repair has wonderful benefits aesthetically. You're giving the patient a flatter stomach, a tighter stomach. Functionally, it does improve your core strength. So I often tell them if they have trouble doing a sit up, doing planks, that will improve. Many patients complain of just being able to bear weight against their belly, and when you examine them and see how splayed apart the muscle is, it makes a lot of sense. Lower back pain can be essentially resolved in some cases. That's not something that I guarantee. There may be other issues going on. Had a very high level fitness patient recently who had a lot of back pain, actually sees one of the back doctors in my group, and she said since surgery she's really had no back pain, which is great, and she's several months out. GU issues, so constipation, bowel irregularity, bladder dysfunction, all of those can be prone to having an abdominal wall pressure that's imbalanced, that's poor, that's weak, and be able to control that with your muscles is a huge complement to the aesthetic results that you're getting during a tummy tuck. So rectus plication, as Dan has harped on last season, this season, often overlooked as far as the functional benefits, but it's this bonus that comes along with it. Now, I do have some patients who come in and say, oh, so let's do that under insurance. And that's not something that I cover under insurance, although it is functionally beneficial. That's part of the cosmetic tummy tuck. Dan, what other parts of the expectations or results are you discussing? Or as far
Yeah,
as
in terms of
when are
like the
they going to see the
duration.
finished product? Mm-hmm.
Yeah, absolutely. So, early on, you have to be patient. You're swollen, you're obviously not feeling so great. But you can often early on see some immediate benefits of things being flat and tight, loose, wrinkly skin is gone. So there's a lot of early excitement, but then, oftentimes at 3 weeks, like, oh, it looks amazing. I'm so happy. I'm like, just wait. Like normally then, the swelling continues to go down. The contours start to show up a little bit more and they start feeling even better, doing all their regular activities again. So I tell patients normally they're going to look pretty good, socially if they want to wear a bikini by 2 to 3, 2 months probably. Um, and 2 to 3 months, kind of a lot of that swelling's gone, but probably 90% probably by 6 months, and then very little subtle stuff up to a year. And scars take time to mature, so they often are kind of at their more red phase between 3 and 6 months. Scar gels, scar therapies can definitely help with that a little bit, but full scar maturation is 2 years, and they often turn into kind of faint white lines for most patients. So it is a process to see that final result, but again, normally you're looking pretty good and feeling quite good somewhere between 2 and 3 months.
Yeah, it's also just getting back into your normal routine. So if you're someone who exercise, works out, you're not at that same level immediately post-op. It takes some time to get back there. Our body's in this recovery phase for 6 or 8 weeks where there's extra swelling. All that needs to go down. So I usually tell patients at least 6 to 8 months, so you're getting close to the finished product. Scars are going to heal for 1 to 2 years. Um, what can you give our listeners tips and tricks as far as finding the right surgeon, or how do they know if they go into the clinic consultation if they are with someone who should do their tummy tuck?
Yeah, so I think we've talked about this a lot. Last season, looking at trying to make sure they're a board certified plastic surgeon. So I mean, there's cosmetic surgeons that kind of will claim to do liposuction only, or these little mini tummy tucks in the office. So if someone's trying to really push you to do an wide awake tummy tuck, just liposuction, you have loose skin, and they're kind of making it sound too good to be true, it probably is. Or if you're getting like some super special deal, you really don't want to be getting, plastic surgery specials. I had a patient the other day who went down to Chicago and required a blood transfusion from all the liposuction she lost. It was just a terrible story. So you want to make sure you find a surgeon that's going to be safe, which typically for tummy tuck requires general anesthesia. I mean, really always. And they're board certified. So those are the two big things. And then, asking, there's a lot of different board certified plastic surgeons out there and talking about experience. I mean, what do you think, for a patient looking for a surgeon, what kind of experience in abdominoplasty should they be, hoping to see when they do a consultation?
Yeah, I mean, those are great points. Just to piggyback on that, I would be looking for a board certified plastic surgeon. I think that shows that they have the proper experience and training to perform these procedures. If they are being pushed to do a wide awake procedure, ask them, what can I do it under general anesthesia? If that's not an option, if the only option is wide awake, to me, that would be a red flag. If you're not meeting your surgeon until the day of the procedure, to me, that would be a red flag. If they're over promising, you're not going to have any scars, or they're saying, oh no, you don't need a tummy tuck, all you need is liposuction. And if you say, oh, I want a tummy tuck, or what if, can I have some skin removed? And they say, no, we don't do that, or that's not a thing. Like, that would be a red flag, because that way, if all they have is a hammer, everything looks like a nail. You want to have the full gamut. We have plenty of patients who only need liposuction. We tell them, but we also have other tools in our toolbox. So, to me, those would be key points. Looking at their website, looking at their social media. Social media is a thing. You want to make sure that they're showing some results. You want to ask them, is this something that you do commonly, something that you're doing every week, day in and day out? And I think you should get a gist of that just by speaking to them about the pros and cons, the risks, the examination, all of those things that, Dan and I just speak naturally about. We're going through, the big key pointers for pre-op, post-op recovery. We know, what expectations are if they're fumbling through that, or guesswork, or, not really pushing you to be educated. If they're not making podcasts about this, you probably shouldn't go see them. No, I'm kidding. What did I miss, Dan?
Yeah, no, I think that was all really good. I mean, again, like we're discussing here, if you do a lot of these surgeries, you're likely going to have lower risk of issues because you have seen a lot of different variations, and you know how to manage those situations, to control them, to do them efficiently, to keep those risks low and keep the patient safe and achieve those great outcomes. So, doing some research, seeing multiple consults, finding a surgeon you really kind of jive with. I mean, there's certain patients where like immediately, like, you're on the same page. You just feel really good about it, and they just have very great experiences throughout the whole thing. And that's what we want to develop that relationship with every patient, but not certain patients are a little bit more concerned, shy, I suppose. But we have a great team to try to make sure you're getting all that information, answering those questions before, during, after, to help you along the way. But yeah, board certification is huge. Safety is huge, which typically requires general anesthesia. There's more and more of these, lipo-only centers kind of popping up. Now it's just PAs doing the lipo. It's kind of crazy. The more of this kind of just unregulated, cosmetic industry, unfortunately.
Yeah, we love what we do. We have fantastic results. Our patients really push us and motivate us. We love seeing how happy they are. We share stories about our patients and see the results, and it's amazing just to get them back feeling strong, confident themselves again, following multiple pregnancies, following weight loss, following abdominal surgeries, general surgeries for hernias, for perforated bowel, for other things, and we can fix that and give them back their ability to wear a two-piece bathing suit and stuff. It's so much fun. Outpatient procedure, just a couple hours long. Anesthesia is super safe. Going to a board-certified plastic surgeon who can really hold your hand through the process is what the ultimate goal is. Finding that right fit, doctor-patient relationship. Shop around. Do plenty of virtual consults from out of town, and if it's a good fit, you can certainly send pictures in, and would ultimately want to meet the patient beforehand. But there's lots of good ways to find the right surgeon, whether it's in Milwaukee or Southbound or other. Dan, a couple key questions that I just wanted to follow up and end with. One thing that I feel like we've missed that is very important in the recovery process is compression garments. And that's something that maybe you can just talk about the length of time, or what the point is of us telling patients to wear fajas or compression garments following a tummy tuck.
Yeah, absolutely. I think the faja compression garments, they're all about controlling swelling, give you some external support for that muscle repair. Your coughing, sneezing doesn't feel very good. just stabilizing things, especially with the drainless approach. We want to minimize friction, pulling, all that. So it kind of just keeps everything where we want it. And I recommend some sort of compression for 6 weeks. I think the first 3 weeks are the most important to prevent the risk of seromas or things like that. And then after that, you can kind of taper it. But, my big thing is always, listen to your body. So if you're like, you kind of lighten it up a little bit and you notice more swelling, then, go back to something heavier. Or if you need to wear something, lower profile for certain events. But, then when you get back, wear the heavier one. So it's not like you have to wear the same thing for 6 weeks, but it's really important, I think. And then at some point you got to stop. Sometimes you see people come in at 6 months, or these post-op photos at 6 months, and they've got these rigid kind of shapewear kind of garments on, and that's kind of not really seeing the true result, but kind of shapewear kind of changing things. So I kind of think 6 weeks and then taper off of it. What do you think? Do you have any other thoughts on that?
No, I would say longer the better. Cold weather months tend to tolerate it longer just because it's cold out. I think at least 6 to 8 weeks minimal to get through that. And then it's really, not constant, not continuous, but, wear it when you can. If you're going out, have some other function, it's not amenable to your clothing. Certainly don't need to wear it beyond that. But first 6 weeks or so is to me is very crucial. I really want patients to buy into, invest in the recovery for the first 6 weeks that follow the surgery. Dan, if a patient has a small umbilical hernia, a little lump by their belly button, does that mean that they can't have a tummy tuck, or is that something that can be addressed at the same time?
Yeah, we routinely fix those, at least during the tummy tuck if they're small and they're easy to reduce. If it's bigger, if it needs mesh, then we might have you see general surgery first. But a lot of times we can manage those. A lot of times we find them and patients aren't aware of them, and it's it's very straightforward to fix. So yeah, definitely something. I've had patients show up like, oh, I just got my hernia fixed, now I can have my tummy tuck. I'm like, oh, that wasn't really necessary. But sometimes they're told that by other surgeons, so they do go through that step first.
Is the C-section scar still going to be there after a tummy tuck?
Yeah, it's a common question. We always go below it. Patients are always shocked that we're going that low with the scar, but we want to keep that scar really low, so we don't want two scars either. So typically we're going at least 1 to sometimes 2 centimeters below it, depending on where that was placed. So you just have one kind of final incision.
So to be clear, the C-section scar is removed. We're going below that, so it's excised as part of the specimen. Sometimes we include tattoo removals for free too, and some of those poor decisions in youthful times when we get rid of those other ones. Can you promise me a scarless tummy tuck, Dr. Butz?
Never. Big surgeries require scars. Anything that's going to tighten the skin like a tummy tuck is going to require skin removal and large scars. But again, proper scar placement, it makes them easy to conceal and really provides very dramatic outcomes. So scarless surgeries, non-invasive skin tightening devices, are pretty minimal at best in terms of the outcomes. So it's all about it's all about just understanding what's right for you and giving you the result you're looking for.
We talked about who makes a good candidate for a tummy tuck. Weight loss, stretched out skin, stretch marks, pregnancies, that sort of thing. Who are patients who maybe are not a great candidate for a tummy tuck? And can you talk maybe about a BMI cutoff, or maybe just where the fat is stored in the belly and where tummy tuck may not be indicated?
Yeah, it's a great point. I'd have a loose cutoff of 32 for BMIs, and
So do I.
I think you can off some patients at 32 are not good candidates though. So depending on where you're carrying that weight, sometimes if you have a lot of visceral fat inside the belly, you can kind of tell that laying down if you still have a lot of fullness, protrusion, or just a lot of kind of high pressure. It's going to be hard to get that flat. Tightening those muscles maybe not really affect how full it looks. So oftentimes I'll recommend trying to lose. Let's see what 20 pounds gets us. Working with weight loss programs, and that's much more available today, or easier. Not easy, but than it used to be. Just to see, is that going to change that fullness? Because just doing the surgery might not really get you the result you're looking for. And if they have a lot of loose hanging skin, sometimes it is kind of a kickstart to kind of a healthier lifestyle. If you have a big apron of skin, removing that can make losing weight, exercising easier, but not everyone, is a good fit for that. And, there's great data that, higher BMIs have higher risk of incision healing problems. So it's really important to kind of, again, for safety reasons as well.
So, tummy tucks are some of our favorite surgical procedures to do. To me, it's just that instant gratification, even on the table, seeing that new belly button that's going to pop, removing all the fat and skin, kind of guessing with my OR team how much it weighs and showing the patients those immediate post-op results, both with pictures and videos and seeing their progress. Dan, what are some of your favorite reasons for loving a tummy tuck, or why is a tummy tuck such a favorite procedure for us?
I think we've, just touched on it. It's just such a dramatic surgery, going from, having this loose skin, stretch marks, wrinkling that really are, don't want people to see, won't wear swimsuits, won't do those activities they want to do. And sometimes functionally are having a hard time doing that, going to the gym, exercising because of the pain. So really restoring kind of their body back to what it used to be. And just, sometimes they come in crop tops and they're showing off their belly button, and it's like they just look fantastic and they're back to exercising, they're feeling good, they're doing all those things. And it's just such a rewarding thing to be a part of. And I'm sure you can have similar stories that send their friends. Like, it's just such a great kind of thing to be a part of.
Yeah, just this week I had someone who she's about a month out, and I just saw her friend for the same procedure, and they just love not having to hide that little pooch of skin and fat that's in their lower belly, whether it's a cliff over the C-section scar that's adherent to their wall, or just have always wanted to lose it. Their kids are grown up now and they want to get back to who they are. It's just a fun experience to be a part of, and one of the reasons why we love doing what we do. Any wrap-ups here?
I had a 6-month. One quick story, a 6-month post-op who came in today, and she had just seen her doctor for like a routine physical, and her doctor was was really impressed with her belly button. She's like, "Who is your surgeon?" She's like, jotted down the names, so it's those little things, those little stories that, make it, fun to be a part of and really take it seriously. So yeah, I think there's a great kind of overview of how to approach your consultation, what to expect out of it, what to look for. We'll be trying to do more of these, kind of covering other common procedures, because they all have little different nuances. But I think that's a great overview. Did we miss anything?
I think it's a good refresher, little cheat sheet. Someone who's driving in to see a tummy tuck consultation, hopefully put this on in their car, listen to the podcast, ask the questions, DM us, message us for other topics or follow-up questions that we missed. Appreciate you guys listening. Great job, Dan. Always very thorough. And have a great rest of the day.
You too. We'll chat soon.
Thanks so much for tuning into this week's episode of Fuller Butz, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butz are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @FullerSurgeryMD or @DanielButzMD. That's Butz with a Z, for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butz.